They were able to lower their medical supply spend by more than 60%. And they're literally saving millions of dollars, putting that into seeing more patients, performing a higher quality of patient care, right? Getting better patient outcomes, saving more lives. And that's, a beautiful thing. And that's exactly why we're doing this. All they have to do, they one-click unlock, they've registered with a new vendor, and now they're buying the same exact item, disintermediated and at half the cost. It's really like from your cabinet to every other warehouse in your network type of system. It's scaling that to being a part of the $1 trillion, industry could save this space, could save this country, could save our patients, right? $500 billion, which sounds like a ludicrous thing. It's like more than half the countries in the world's GDP, but it's a real number. As much as possible, start with a real problem. That's, I think, the most important thing.
Welcome, everybody. This is an Hour of Innovation podcast. I'm your host, Luka. Luká Yancopoulos joins me today to discuss the healthcare supply chain and how his company helps doctors focus more on patient care while spending less on medical supplies. Welcome, Luka. Thank you for joining me today.
Hey, thanks for having me today. I'm very excited to be here.
Yeah, great. So before we jump into the main discussion, can you please share a little bit of your background and the work that you do?
Yeah, absolutely. I guess when you say background, you're saying sort of where we're at today, not where my company started or how we got here, right?
Yeah, just a little bit about yourself, basically.
Yeah, absolutely. I'm a founder of Grapevine Technologies, a venture-backed healthcare technology company. Our focus is to help doctors cure illness by relieving them of the time and energy that is spent on managing supply chains, dealing with back orders, dealing with shortages, and trying to figure out how to perform patient care with supplies that they either can't find or have constantly rising costs. The way that we do this is by offering a healthcare procurement platform. People simply link their various suppliers to a single screen, and Grapevine takes over as a 22nd century world-class procurement department. We act as sort of the brains and minds behind, some of the biggest healthcare institutes here in the U.S., and we drive more than 70% savings on medical supply spend.
Okay, that's great. So, what was the biggest pain point that you identified and inspired you to start Grapevine?
Yeah, so I was actually I always wanted to be an engineer and a technologist and an innovator, but I was actually focused on renewable energy research back in 2020 when COVID happened. I was doing research at University of Pennsylvania. I was in a dual degree program, for all sorts of things from blue energy and DNA sequencing and nanopores and nanotechnology. It was a very cool program. But then COVID hit, and an event at that scale changes your perspective, especially when, in my case, both your parents are frontline heroes and frontline workers, right? I'm hearing about supply chain shortage. I'm hearing about, price gouging and unfair prices. My parents are wearing the same N95 mask and bringing home stories of, surgeons wearing garbage bags over their clothes in the operating room because they didn't have what they needed to perform patient care. Patients were, left out in the hallways. We didn't have the supplies we needed to treat them. People died because the supply chains failed. So when that sort of thing happens, and when, I'm scared as I was for my parents' sake and safety, and I didn't know what would come, it wasn't really an aha moment as much as it was a terrifying feeling that caused me to take action. I felt like it was the only option I had. So I stopped focusing on the renewable energy stuff and dove headfirst into healthcare supply chains. And really, we were focused at the time on supply chain resilience. So solving back orders, right? Mm-hmm. Finding products that doctors and nurses and healthcare institutes couldn't find. And what we ended up building, in a post-pandemic world, ends up being a great system for optimizing supply spend and getting, your prices down significantly by creating competition between the different places that sell your products.
Yes, so basically you identified some sort of gap in the supply chain. The system collapsed when everybody had to, either stay with lockdowns or people could not travel and deliveries could not go through, and the collapse of supply chain basically motivated you to jump and start helping there.
Yeah, absolutely.
Yeah, okay, that's great. So what's the platform, Grapevine platform, and what exactly, um, what's the operations of it? How does it help with operations processes for businesses and for medical personnel, hospitals?
Yeah. So our goal, right, in a new medical practice using our platform is to cut last year's spend by 70% and let, all these health, no one has to shop again. No one has to go online and place an order again. That's a success case for us. And it's something we're still working for a lot of our customers. And the sort of status quo of where they're at today is, they maybe have 5 different vendors for the different product categories. For surgical implants, they work with one person. For masks and gowns, they're working with someone else. For machinery and exam tables and lights, they're working with someone else. So they have these 5 different vendors. They have a sales rep with each vendor. They can't remember who they're ordering, which of these product categories from. And when they need to order something, as far as they see it, they go to one particular vendor for that product category, right? And by doing that, you're essentially handing, as the medical practice, you're handing a monopoly over to these vendors. The vendors know you're not going to go anywhere else. For the last 10 years, you've bought the same exact products from them. You're not gonna change your behavior, and you're not going to go to another store or another seller. And it allows, unfortunately, a lot of these vendors to take advantage of the suppliers. The prices are whatever the vendor wants it to be because the customer isn't looking anywhere else, even if the same product is, on another shelf of another storefront at half the price. So
Hmm.
these problems aren't just, financial problems. I'm talking mostly about the financials, but they're also, shortage problems. Depending on a single supplier, makes a supply chain only as strong as its weakest link, right? When that supplier runs out of stock, where do you turn? Well, that's your only supplier for that product category. So you're left out to dry, and they're, scrambling, trying to find new sources of these same things. And it's not a good setup to have. So the way that Grapevine really works, to answer your question, is you log on a Grapevine. It's a free platform. You link the different vendors that you already work with. We read in your contracted prices, your negotiated prices directly from those third-party vendors, all into one screen. So now everything that you used to shop from 5 different websites is now on a single screen. You can add products from the 5 different websites to a single cart and place an order, and those orders shoot out to your, 5 different suppliers. But that's really just where things start. And it's a convenience. It saves people a lot of time, not having to go through the different websites, the different sales reps. But it doesn't necessarily save them, the money that I'm talking about. So what we start to do in the background, as this data is loaded in, as your prices and your products are loaded in, is we're checking for sort of replicates of the same exact product coming from different sources, whether that's your trusted suppliers that you've linked to the platform or one of the many different integrated, and we call them like unlockable suppliers inside a Grapevine. So oftentimes people are working with, a large distributor, a McKesson, right? They do $300 billion of revenue a year, and they sell, almost 1 million products, right? That's the sort of
Hmm.
companies they're working with. McKesson's buying everything from other US-based suppliers, right? They're bringing it into their warehouse, which costs something. They're marking it up to make a profit, and then they're reselling it to you. So if there's an opportunity to disintermediate, right,
Yeah.
cut out the middleman and his markup and go straight to the source, we present that as an opportunity. Most people will start using Grapevine. They'll say, I just want to work with my suppliers, but we continuously urge them to connect
Hmm.
directly with the source, the upstream manufacturer importer who has it in the US, has it at half the price, right? And all they have to do, they one click unlock, they've registered with a new vendor, and now they're buying the same exact item, disintermediated and at half the cost. Not only that, but they're tapping into a broader network of warehouses. So when there is a shortage in one warehouse, a McKesson warehouse or somewhere else, they're able to, look broadly across that network. And all this is done in a very simple way, right? We're not showing them 50 options for the same product because there's 50 different sources. They just add to cart the one product, right? And we make sure that order punches out to the smartest source. So it's not like on Amazon where you're seeing 50 different versions of the Bounty paper towels, and you're like, which one's the best price? You're only seeing one. You're not even seeing the price, but on Grapevine, you know it is the best price every time you place that order.
Yeah, is there some sort of like a rating for those suppliers, or they're vetted already and they trusted and everything? So
yeah, it's not as simple as like a 5-star, rating, because that's like,
right.
okay, well, what makes them 5 stars? Oh, they were a little bit impolite to me, right? That might be like some of the Yelp reviews on a restaurant or whatever. So we just track the data. So like the things people care about, the functional things people care about, right? What is the average lead time, right, for when you place this order, for getting it to your practice? And when you order, we will find the best option specifically curated for your preferences. So things that are included are, how fast does your company, need the delivery to come? How much do you care about price savings? Are you willing to look at different brands, or do you want to stick to this one brand, this one manufacturer of an item? There's a lot of other data that we sort of read in the customer sort of sets during their onboarding ceremony. And from that point forward, things are very much tailored to their needs. And obviously, a customer's preferences change. Even though they might be able to tolerate a 7-day lead time, most days of the year, today they have a surgery, this afternoon, and they really need this implant or this person's going to die. Right. So they're able to sort of look through, if they want to, deviate from their normal preferences instead of optimizing for cost, optimize for speed. They can do that. It's a single click of a button.
Yeah. Does it apply to like non-prescription drugs as well? Like the ones we can buy in like CVS or whatever?
For sure. Yeah. It's everything that these medical practices buy for running their business. So it's even got stuff like, printer paper and ink cartridges, and then all the way up to prescription drugs, surgical implants, needles and syringes. It's the whole breadth.
Got it. Everything basically. Okay.
Yeah.
So what would you call or say is the biggest differentiator of your platform versus any other platform that may be out there for this?
Yeah, I think that's a good question. And I guess my answer depends on how you think about, different and being a differentiator. So from a customer consideration perspective, our platform's free. These sort of platforms, they call them procurement platforms, are usually costing businesses somewhere between, $5,000 and $30,000 a year, right? Our platform is totally free. We won't take a single dollar from you until you save money. And the way that we make money is when you save 50%, 60%, we take a small percentage of those savings. So if you don't save money, we don't make money. And we're so confident in what we do, and we've done it, hundreds and hundreds of times, that we're comfortable and cool with this business model. And I think it makes it really easy for people to give things like this a shot, right? It's change is hard, and we want to minimize the sort of costs of switching. That's one big difference. I think another big difference is, a lot of these platforms have the goal of sort of organizing, and it's the way they even market themselves, but it's multi-vendor management. Put the different vendors onto a single screen. Their goal isn't to, like, what's the point of more vendors on a single screen, right? Well, it makes you more resilient. We can solve back orders that happen. So let's say you place an order for something, and that thing, the supplier says, oh, it's going to actually take 2 more weeks than we thought. Well, on any other platform, you're left there looking at it saying, oh, can I cancel this order? Trying to figure out how to do that, right? On Grapevine, that never happens. The second that the back order occurs, the delivery timeline gets pushed back, what we do is we automatically cancel the order, find the same exact product from an alternative source, and go out and place that order. So you're still getting it at the same time. There's no such thing as a back order through Grapevine systems, because the moment the back order occurs, the order is redirected to a new source. And I think that's a really cool thing. We solve back orders before they happen. And we drive a huge amount of savings. And there's a lot of other aspects. I think the last big differentiator for us that I'm proud of is we are not a healthcare procurement company. Today, our main service offering is healthcare procurement software. That's for sure. But our goal, like I said at the start of this, is to help doctors end illness. And we really do believe that we can do that. It starts with procurement and supply chains, the thing that brought us into this space. But that's just our beginning. I mean, in the next 6 months, we'll be building products for patient care, patient billing, health insurance, different sort of things that are going to let, again, doctors, researchers focus on nothing more than ending illness. And the entire business administration can be put on autopilot and done smarter and better and easier than they've ever seen before.
Yeah, so I was thinking when you were saying that it kind of automates the communication, collaboration between warehouses and suppliers and purchasers. So you don't have to spend much time trying to figure out what you're running out of. Is there a way to connect your inventory to this and then it automatically refill it with the trusted suppliers?
Yeah, I think that's a great idea. So we're actually planning on launching something exactly like that on basically Q1 of next year, so January-ish of 2025. It's a mobile app. You can basically take a picture of your supply cabinet, your closet, anywhere else that the inventory is in. We automatically read in the amount of inventory that you have in stock. And based on your consumption rates, based on how much you need to treat your patients, orders will automatically fly out. So that's one of the ways that we plan on, never shopping again for our medical practice is snap pics of the things that are in your cabinets. And that's all you have to do. And there'll never be, an add to cart or a place order situation again. There's never a back order. Why is this delayed again? There should be no time spent shopping, not just simplified shopping, but literally zero time looking at a screen and punching the buttons at cart. We don't need to do that. Things here are very, and it's different than the way you or me might shop in our personal lives, right? I, want something new and trendy. I get that new tech, that new, the new headphones and think I'm getting an upgraded experience. A lot of times in healthcare, they're buying the same thing every single month, same quantities. There's fluctuations seasonally where they'll see more patients, but there's beautiful patterns in what people buy, how much they buy, how often they buy. And a lot of those patterns we study with machine learning. And after a few months of using Grapevine, an order never needs to be placed again. Every single cart is built for you. It's sent out for you. If you want, you can check it and balance it, right? Make sure that we're not going to over order for you, but you can turn the entire supply chain operation over to, an AI powered procurement machine that is Grapevine.
Right.
And you could be as involved as you want through our platform.
Yeah. And I guess if you have a scheduling of future visits for patients, I'm thinking my dentist, for example, if they know 6 months, 9 months ahead of time that I will go for certain procedure, they can pre-order stuff. And when I show up, I did this, aligners a while ago. Every time I go, I had to wait 2-3 months for them to go place an order. Manufacturer produces them. Then they call me in again so I can come in and they can make sure it fits and everything. It's pain in the butt. But with the system like yours, hopefully I come in once and they do everything and they call me whenever it's ready. So I don't have to worry about it.
You're spot on. And that's another thing that we've recently started doing is reading in the scheduling of appointments, right? And being able to see that data. And for example, as you might imagine, doctors that see patients for the flu are seeing a lot more patients in November, December, January, February, right? Than in, July. So based on your upcoming patient appointments, we can adjust those scheduled reorders. We predict the patterns of what you'll need. And we increase the amount in your supply cabinet. It's really from your cabinet to every other warehouse in your network type of system. It's not as much, it feels like a shopping system in how people use it today, but it's much more than that.
Yeah. Do you have any example of existing customer that dramatically improved their operations efficiency or anything like that? You don't have to mention names, but just maybe a couple of stories there.
Yeah, they're doing a press release about it. It's a public company. It's called the Oncology Institute. So I can say the name, the Oncology Institute of Hope and Innovation. They do cancer treatment and cancer research. They're national. They've got 80 something cancer research facilities across the country. In using Grapevine, they were able to lower their medical supply spend by more than 60%. And they are literally saving millions of dollars, putting that into seeing more patients, performing a higher quality of patient care, right? Getting better patient outcomes, saving more lives. And that's, a beautiful thing. And that's exactly why we're doing this. The doctors are always able to perform at their highest sort of clip, highest capacity, because they always have what they need when they need it. And the business is able to reinvest those dollars into delivering better patient outcomes. So it's not happening universally yet or on, a global scale, but we have been able to end illness for more patients, because of the systems that we put in place at the Oncology Institute. So we're pretty excited about that. And the amount of time spent shopping is down by like 95% compared to what it used to be.
Yeah. I also wonder, with this savings, how much of it can be passed on to the actual patient? I imagine over time it could be, right? If not immediately.
That is my, one of we set big goals and big dreams here, and we don't let practicality get in the way of, creativity and dreaming large. I think it's important to set a goal that you can achieve. And if you can easily achieve your goal, you think you can do it, then you're not setting your goals big enough. So when it comes to the patient care costs, I mean, I consider Grapevine in the long run not just a solution for medical businesses, but a solution for everyone, because at some point in our lives, we all become a patient. We can all agree that we've gotten a medical bill and looked at it, our eyebrows pop off our heads and, can't believe how much this thing costs. So yeah, we believe that those dollars can and should be put back into the pockets of patients. We believe that, the long-term effects of what we're doing beyond just supply chain and medical supplies, but, for these businesses as a whole can one day make healthcare free for all patients across this country. And there's a lot of steps and a lot of years in between us and making that happen. But the fact that it's, improbable and it's a real challenge and maybe even sounds impossible, that's what gets us excited to get into it. We think we can make healthcare free for everyone.
Yeah, Grapevine is a young company, and you guys are all young, so you can do it. There's plenty of time still.
Yeah.
Yeah, for sure. Is there a vision for Grapevine to transition to other industries that may need supply chain optimizations? Like any grocery store, for example, to give some basic, simple example.
Yeah, there's a lot of nuances of healthcare that make healthcare like really unique. And I think it's hard for a lot of other spaces that handle supply chain to really productively transition into healthcare. You haven't seen it with Amazon in a productive fashion. You haven't seen it in a lot of the big supply chain players. So our focus is healthcare, and like I said, we're focused on doing more for healthcare than taking supply chain and doing it across more industries. And there's a mountain of problems, for the healthcare facilities and things that, we don't see as that great of a challenge or even, or impossibility of getting done. So any way that we can continue to lower the cost for the business, ultimately lower the cost for the patients, that's what we're going to focus on. We're going to spread rapidly beyond healthcare in this next year, or beyond supply chain in this next year, but continuously focus on serving the doctors and ultimately serving the patients.
Yeah. Okay. Yeah, I understand. It's a very important area to focus on. So for sure.
Mm-hmm. Yeah.
Oh, you mentioned a couple of things for the future for your company. What would be your few things, maybe the top of your list for the next 5 years that you would like to achieve?
Sure. The way that we sort of think about, the way that I think about achievement is problem first, right? Like, what is the biggest cost? What is the biggest problem in the space for the people that we care about? And addressing that, fixing that, minimizing that, right? Like, that is the achievement that we're seeking out. And generally, when you're able to have a real impact on real people, the money sort of follows. And so far for our business, that mindset has worked. As far as goals that we have, it's really about the problems, I guess, that we've identified for the same people that we're working with today. The biggest problems that we've got on our radar are doctors, especially independent practices, getting paid by insurance companies, right, and patients for the care that they perform. A lot of times, these doctors, the dentists, they're sending you a bill in the mail months later, right? And it's for the copay. It's for a fraction of what they should actually receive. The person who's actually responsible for paying them a lot of the time is either the federal government, right, or the insurance company. And they're constantly trying to weasel their way out of paying those bills for you. And who gets left on the hook is the doctor. So then what does the doctor do? They're forced to charge the next patient even more money because the insurance company didn't pay them for the first patient. And it's a bad cycle that, again, drives up costs for everyone. So being able to sort of guarantee that these medical practices bring in the income that they deserve from the insurance company, that's a big thing that we think we could play a strong role in. I think another point that you mentioned is we're already tapping into the appointments that are scheduled, right? So if we can basically build a marketplace, not for doctors or medical practices to connect with suppliers, but for patients to connect directly with a network of trusted doctors who are using Grapevine and cutting costs, who can pass forward a lower price of healthcare, to these patients. That's something we want to get into. So actually helping doctors manage the scheduling of patients, connecting that, helping patients find new good doctors, and even potentially passing around the health records. I mean, in a lot of ways, I don't know about you, but I've moved a couple times in my adult life from Philadelphia to Los Angeles to New York. And every time I move, I got to go to a new doctor. And they say, oh, you got it, new dentist, do new x-rays. But I just did x-rays 6 months ago at the other dentist. Or,
Right.
I got, new blood work, new this, new that. And then I say, okay, can I call up my old doctor and get them to send you the records? And they say, sure, get them to send us the records. I called the old doctor. He says, do you have a fax machine? I'm 26 years old. I don't have a fax machine, right? So now I'm going online, I'm buying a fax machine, trying to get this paperwork to put it in a folder and bring it to the new doctor. So I want to help solve that solution for patients too. If we're getting into the space of, getting the doctors paid and helping patients find those types of doctors and book their appointments, I want to take it a step further for making that sort of patient booking and information sharing related to my biology and my health issues very easily accessible to every new doctor that I see. I don't want the doctors and the medical practices to own my health records. I want to own them as an individual person and be able to use them to serve my health needs. And it doesn't feel that way in the US, and it doesn't feel that way as a patient, and we can do better. So I think that's another area we want to attack and, contribute to as we start to get into the world of patients.
Yeah, that's funny that you mentioned this because I'm from Kazakhstan. It's a former Soviet Union country, right, from 80s. And I remember up to like middle school, pretty much, I had this big paper, like notebook with all my visits to doctors, with all these paper records of my exams and lab tests and everything. And that was my record, my medical record. I used to keep it at home. Anytime I go to doctor, I would give them this and they will go through history of it because there were no computers, no digital records back then. And that's funny because that's exactly how we like going back, owning your own records and not some doctor keeping the file and they don't even let you use it later. That's crazy. So I heard some people, maybe it was just an idea or somebody actually tried to implement something on blockchain about that. But again, that's going to take a while and who knows where we end up with blockchains. I don't know. So
it's great. Everything you said, is really striking a chord with me. We actually just we recruited someone who's working at a blockchain company and brought them in to start working on this exact problem. So we have a new engineer background in blockchain because we need to securely handle your patient, health records and whatnot. If you're going to store it on your iPhone, we got to make sure that no one sees it, including Apple and anyone else, right? So how can we make sure that truly you own that data, but also in a convenient enough format that you're not printing it out and putting it in a folder and carrying that thing around, because that's not very secure either. So blockchain could be a huge solution for making sure that you own your health data and it's encrypted in a way that, you're comfortable with and is kept safe for your needs.
Yeah. So let's talk about measuring success. So you mentioned you have a metric of saving costs for people or for doctors. Do you have any other measurements that you're tracking as a business, as a product?
Yeah, like other things that we do, right? And it's pretty simple stuff, but like the GMV, like the finance guys care more about, certain revenue goals and numbers and whatnot. So we've basically the spend that runs through our platform sort of before the savings, about $10 million this year. We're 18 months post launch. So we're pretty excited about that. It's our first full calendar year. And there was more than $10 million that that would have run out of the pockets of these medical practices, out of the pockets of the patients, and instead, turned into $5 million of spend through Grapevine that saved another, $5 million. So we're averaging about 50% savings rate on the dollars spent through our platform. But the actual volume is important. We're talking about an industry that spends almost $1 trillion in the US on med supplies and pharmaceuticals, right? So 50% on $10 million may not be much, but we're just getting started, and, scaling that to being a part of the $1 trillion, industry could save this space, could save this country, could save our patients, right? $500 billion, which sounds like a ludicrous thing. It's like more than half the countries in the world's GDP, but it's a real number. There's other metrics, but we're really an impact driven, an impact first company. So the way that we like to quantify or qualify success is based on, the impact, the compliments we get, the ease of accessibility, the ease of sort of solution that we've implemented at these medical practices.
Yeah. Okay, that's great. So since you in the healthcare industry, do you see any trends related to the healthcare supply chain, especially maybe some new opportunities or just trends in general, where is this industry going?
Yeah. I think that diversification is a big word that people are now interested in after like a big idea and philosophy that dominated healthcare supply chains pre-COVID was economies of scale, right? Let's put all of our dollars into one vertically integrated supply chain, one linear chain, right? We buy everything from one big distributor if we can, because that allows that distributor to operate more efficiently, bargain for a better price, we get a better price, and that all works, right? It was a total fallacy. I mean, as far as resilience and backorders and shortages, that is a large part of what led to the disaster, in supply chain response during COVID, right? People didn't have alternative links to swap in when one link in their chain broke, right? So the supply chains were only as strong as their weakest link. We've built a more of a network style thing. So if you think of a soccer or football net, right? People, kick the ball into it. One of those little things breaks, the net stays perfectly in place, right? You don't want a supply chain. You want a supply chain network. And that's a part of what we do. And it's definitely a big trend. So even if people aren't using Grapevine, there's from the biggest healthcare business in the world to the smallest ones, a response to this COVID, a response to how screwed they got during the pandemic is, well, let's onboard more suppliers. Let's bring in a backup supplier. Oh, wow, this supplier actually has better prices on some product categories. Let's go with them on this. So supply chain diversification is something that we're seeing more and more of. Obviously, there's things related to, prediction, machine learning, AI, and we're folding those in, but it's, to create value from those things. It's not the sexy stuff. Oh, there's going to be, doctor robots running around and curing patients of cancer. Maybe not. But it's the diamonds in the details, right? So we're implementing those things in very specific ways that can drive more efficiencies for the people that can really serve and provide patient care and the systems behind them. So,
yes. So, how do you think innovations like this in healthcare supply chain can potentially influence other public health things, not just supply chain, but everything else or some other areas maybe?
Yeah, it's I mean, as far as other related areas, right? And like I said, we're going beyond supply chain. I think that the people that actually make vaccines or drugs or even the devices themselves, they can and should consider the same philosophies, right? When it comes to the raw materials that go into the factory, right? Like a medical device is made of 1,000 little parts and different materials, right? So if you're depending on a single supplier for all of your spun-bound cotton, right, or whatever, you may not have the best price. But if you look across 5 different, potential suppliers and you're evaluating in real time based on their availability, your ability to constantly manufacture and produce goods becomes more stable and your price goes down. So I think the diversification aspect is something that is going to touch not just medical practices, but also the medical device makers. I think that, in a good world, in the world that we're talking about, where you can easily own your own health records and share those with different doctors, patients are able to do the same thing, right? Like, it's hard to get a second opinion right now before getting a surgery. When I got x-rays at one place and they own my patient data, right? If I
Mm-hmm.
own that in my pocket and I can tap to share it the second I walk into a medical practice, suddenly as a patient, I can build my own healthcare network, right? I don't need to go to Northwell or New York Presbyterian or some massive system to be able to share, but I can work with individual specialists that run their own practice, and be able to get them up to speed on who I am and what's different about my health history in an instant, in the tap of my phone, like Apple Pay. And that's something that we definitely strive for. So diversification stretches well beyond, supply chain and medical practices. And we think we'll see that a lot more in the health space. And I think that people owning their own data is another big aspect of change that we're seeing, right? Whether that's a medical practice being entitled to the data, the prices, right, from their various suppliers, or patients being entitled to their own health history, right? Like, the person that the data is about, the person that the data is for, that's who really has a right to this data. And we believe in freedom of information and letting information sort of spread through the interweb to benefit the consumer, ultimately benefit the patient. So we think that we're going into a direction, not just us, but the world, where healthcare costs will go down one way or another for patients. It may take some policy changes and a couple decades, but we believe in a world where, you can cure yourself of any disease that you got, and do it at a reasonable cost, or maybe even free.
Yeah, that's awesome. And I also hope that maybe insurance companies will follow the trend, if you will, and will try to somehow maybe even plug into the system, or use some parts of it to, provide better pricing for people and better pricing for doctors so they can participate in this.
Yeah, I think the insurance companies are one of, if not the biggest problem in the world of healthcare right now in the U.S.
Yeah.
I mean, it's basically like a raffle ticket system where everyone overpays except for the one guy that gets screwed, and the only person that always wins is the insurance company, right? And it's not a system
Mm-hmm.
that's built to serve patients. It's a system that's built to preserve these massive companies, some of the biggest companies in the world, and people are upset about it. I don't know if you heard, but
Mm-hmm.
probably the biggest, maybe it's the biggest health insurance company in the US, United Healthcare, their CEO was just targeted and shot and killed 2 days
Yeah.
ago. Yeah, insane.
Yeah. Yeah, I heard the news. That's terrible. Right in the, middle of the day.
Yeah,
So,
it's
yeah, that's
terrible.
crazy. So, what is, while doing all this work, what was one of the most surprising things that you learned?
Yeah, I'm the age where I grew up with, by the time I got to middle school, I had a flip phone, cell phone. By the time I got to high school, I had an iPhone and a laptop, right? And when you're growing up in that age, I think that there's a lot of things, that we don't know, and a lot of magical technology that's put in front of us. And when you see, and you could order something on Amazon and it comes the next day, right? Like, it is a world of privilege living in the US in the 21st century. And, we can all touch it and we all see it. And I think that when the world is as amazing, it is when amazing technologies around us at all hours of the day, right? We lose touch with our own ability to create something that good. It just looks like magic and it feels like magic when you use that and you have it in your pocket. And you assume that the rest of the world must be as good as, like, surfing the web from my iPhone, while going down the subway. And
Mm-hmm.
as it turns out, most of the world and most of the technology that massive systems like the healthcare system run on are way less modern than the things that we have in our pockets, right? Like, consumer technology, consumer supply chains are way more evolved than what we're seeing in
Mm-hmm.
this space. So probably the most mind-blowing thing was, it feels like, throughout my pretty short career in healthcare supply chains, we've done nothing but go back in time as we've learned more and more about healthcare. This is a space where people are naturally, all people are naturally resistant to change. We like our habits, and if we don't have to adopt a change, we tend to avoid it. But in this space specifically, change isn't just a matter of being like scared or preserving habits, but change can change patient outcomes, right? For the better or for the worse. So these people, these doctors, their job under the Hippocratic oath, right, is to do no harm. If they're not sure if adopting a new piece of technology is going to benefit their patients, it is their obligation as a doctor to say no to that change. So these systems are literally like decades behind. And the things that I learned at Penn in computer science, while getting my degrees, were like they didn't even teach us about. They hadn't been teaching things like EDI, right, since like 1993 in the computer science department at UPenn. So I'm going back, finding old textbooks that aren't even, in libraries anymore to try to learn about what we're, the mediums that we're working with here. And it's mind blowing. It's a little bit sad, but it also presents a ripe opportunity, to create a big impact.
Yeah, that's interesting. That reminds me of financial industry with all these old banks with still on mainframes. So yeah,
Insane.
Yeah, it's insane. So we're coming to the end here. So how can healthcare professionals or maybe doctors and businesses engage with your company? How they can find you?
Yeah. Like I said, our platform is free. You can go to go-grapevine.com. That's like go hyphen symbol, grapevine.com, like the Marvin Gaye song, Heard It Through the Grapevine. And yeah, you could sign up on there for free. Really simple. From that point forward, someone on our team reaches out, connects, and yeah, gets you onboarded, and you'll start saving within, a few business days. So it's the easiest way to get in touch with me and my team.
Okay, pretty cool. And lastly, what kind of advice can you give to people who may be listening and getting inspired to innovate and build some cool technology like yours? What can you tell to them?
Yeah, as much as possible, start with a real problem. That's, I think, the most important thing. You might have a cool idea and it might be cool to you, but think about if it actually addresses a problem. Because, like I said, change is scary. People are scared of the future. We're scared if we're going to be a part of the future. We're scared if the future is going to care about us. We're scared if the future is going to become something that we don't want to be a part of, right? And the future can be really scary. So I think it's important to, not just, meet a customer where they're at, but start with a problem. Start with something that they actually want to change, right? And if you have something that they want to change, something that bothers them every day about their life, then you start working up and thinking of different solutions. And you throw the spaghetti on the wall and see what sticks at that point at the problem, with the hope of taking that problem out of their lives and replacing it with something that's simpler, cleaner, more elegant, more beautiful, and a better time. And then people say yes, right? People say yes to whatever you're selling. If your answer is, I'm selling you something that solves your problem, it costs less than the pain that you feel every day, right? Like that's what a solution is. It's not some cool idea that you cook up that you get excited about. It's a real problem that people are looking for a solution for. So
Yeah. No, that's great. I totally agree with that. Yeah. All right. Well, thank you very much. It was a pleasure talking to you.
Likewise.
And hope we can stay connected in the future. Good luck.
Thank you. Thanks for everything.
Luka.
Thanks for having me on today. Appreciate you all listening.
Talk to you later.
Bye.
Yep. Bye.